My name is Christopher Formusa. Again, thank you so much for coming. I'm just going to give you a little bit of a rundown of what the program is going to look like. So first, we're going to start with some speeches. We have a great lineup of speeches here for us today. Then we will do the actual ribbon cutting ceremony. So again, I'll make some announcements at the end of the speeches, just letting you know to bear with us as we set up for the ribbon cutting. Then after the ribbon cutting, we're going to have our line dancers perform. Wow. So if you noticed, on your seats here today are red envelopes. Make sure you give those envelopes to the line dancer as they pass you. Okay, and if you don't have a red envelope, let us know. We'll make sure we give some more out. Okay, and then after the ribbon cutting, we have an open house style format here for the tours. So we have staff located on every floor of the building. There are 6 stories of the building. So after the ribbon cutting, after the line dancer performs here, we would like you guys to go spread out throughout the building and greet the line dancers and also continue to give out some red envelopes and also check out our beautiful brand new space while you're up there. Okay, without further ado, I would now like to introduce Kaushal Chawla, our Chief Executive Officer of the Wang Community Health Center. Thank you.
Good morning. Good morning. All right. Welcome to the Charles B. Wang Community Health Center at 131 72 40th Road, also known affectionately as Healthview. Today is a day of excitement, of celebration, and of reflection. We are excited about the completion of this beautiful 80,000 square foot, 6-story modern healthcare site in the heart of Flushing, which will expand primary care and mental health and dental services to the area. We are also celebrating all of the people who made the project possible: staff, board, partners, funders, donors, elected officials, well-wishers, and supporters. And finally, we're reflecting today on our journey as a health center, from humble yet gutsy beginnings to where we are today and where we're headed. So I will be your MC for the next 30 minutes. We have a great lineup of speakers. We will then officially cut the ribbon, as Chris mentioned. And after the ribbon is cut, we invite you, there'll be lion dancers to bring good luck and prosperity to all of the floors in the building. And we'll invite you to tour the building. Okay, let's get started. I would like to introduce the chair of our board, Mr. Ogen Ong, to help me welcome you all today for the event.
Can you hear me?
Yes.
All right, good. So, welcome. Celebrate with us to our community and our government partners, our people of the Charles B. Wang Community Health Center. This is possible because of you. This is Healthview, our new house of healing. And given the context of New York City, this country, the world, having a house of healing is a good thing. Now, to set your expectations, right? My role, and by the way, your role, is really gonna help warm up for the real honored guest speakers to come, okay? So kind of stepping back, we were sparked 50 years ago by our volunteer founders and dedicated doctors. They invested their sweat equity to meet the health needs of the underserved in our community. This DNA has passed on to us. This is who we are. That was the start, more to come. Then we backed it up with a history and a track record of investing in this community to serve the healthcare needs of the underserved in Manhattan and in Queens, with 5 locations. So, for this is who we are. That's your cue. Repeat after me. This is who we are. This is who we are. Thank you. More to do. Now with Healthview today, we continue this journey in investing to serve the healthcare needs of the underserved for our community. Okay, your cue. This is who we are. After today's program, we welcome you to walk around, tour this facility, which was constructed, I'm going to use different words here, it was constructed with an abundance of tender, loving care. And just when you flow through it, you'll feel it, you'll see it. Now, before I conclude, I want to give you a sense of our historic growth, which is now, today, the recent years, we now serve 60,000 unique patients a year. From 1970s to 2021, when I use revenues as a proxy for this, that meant our compounded annual growth rate was 15% a year. In absolute terms, that meant we grew 700 times. This is a result of us investing in the healthcare needs of the underserved. So our all-important mission remains, it's about high quality and affordable care to all. This is who we are. More to come. Thank you.
Thank you.
Who else thought you'd hear the words compound annual growth rate? To many people, our next speaker is synonymous with the health center, and for good reason. She is one of the founders of our health clinic, and in the 50 years since its founding, she has been a dedicated board member, a philanthropist, and one of the visionaries behind this Healthview site. Please welcome Marie Lam.
It is amazing to see how far we have come. In 1971, along with a group of volunteers and community people, we organized the first health fair in Chinatown, closing off Mott Street for 10 days. And after that, we had to follow up on the patients, and we established the first free clinic on Henry Street on borrowed space from a Church of Our Savior. And then in 1999, the clinic was renamed the Charles B. Wang Community Health Center. It continued to provide bilingual and culturally sensitive healthcare to underserved communities. And the patients that we serve are mostly the Asian community. Today, we have 500 staff and 5 sites, and this will be our 6th. We could not have done all this without the support and encouragement from many of you in our audience. And it's been 52 years. Thank you for being part of our future and journey.
It's always inspiring to me to hear Marie describe the journey since 1971. The one thing I admire about her is as much as she has done for the health center, she always remembers everyone who helped the organization along the way. And with that in mind, it's time to recognize some of our key partners and advocates who helped make this project financially possible. And they include Flushing Bank, the New York Regional Center and the Build NYC Bond Program, the New York City Economic Development Corporation, the Queensborough President's Office, former council member Peter Koo, and the New York City Office of Environmental Remediation. There are many more, but truly we would not be here without their partnership. And at this time, I would like to invite a couple of our partners to the podium to share in our recognition and to share remarks if they like, no pressure. So first, I'd like to invite former council member Peter Koo, who has been just a staunch advocate for us. Come on up, dude. As a council member, Peter supported this project by providing, through the city council, capital funding over $2 million. And there's so many other ways in which he has supported us throughout the years that would take very long to talk through. So, Peter, thank you.
Thank you. Hello, everyone. It's so good to see old friends and new friends here. Especially after the COVID. CBW, I call it CBW, it's easier. Health Center. As always, I always have an affinity with CBW in my heart. Because why? Because health is really important. I was council member for 12 years, and right now I'm the senior advisor working for public safety in the mayor's office. Public safety is actually public health. Public safety starts when all these ladies, before you're pregnant. You have to make sure, right? You have the right nutrition, all this stuff, and then you have a healthy baby. Before you're not alcoholic, you make sure you're not like drug addicted, right? Otherwise, your baby born is very a big problem for our community. So public health is very important, especially lately I found out mental health. The city has a lot of public safety problems because of mental health. Because they cannot hold a job. They always fight in the family. They get kicked out of their apartments, right? So they live on the streets. How can you expect them to live a normal life on the street? It's so cold outside, it's in the wintertime, right? They do crazy things. That's why mental health is the #1 issue we have to take care. So I appreciate Charles B. Wang Center has a very good mental health program. Why? Because I found out from my friends. Some of my friends, they have or their daughters or their children, they have mental health problems. And mental health is not like cancer. When you say I have cancer, people have sympathy on you. Oh, you have cancer. But when you have mental health, you don't want to say it. You keep it inside your family. You feel that you have shame. So that's why mental health, we all have to tackle. Each one of you, make sure we do our best. When you see people have problems, refer them to the psychiatrist or the health clinic. It's important. And right now I'm working in the city, so I found out a lot of discrepancies. We spend a lot of money on Department of Education. The outcome is not good, right? Almost 40% of the students in high school cannot meet the passing standard of the state. And healthcare is almost the same. We spend a lot of money on healthcare, but our healthcare outcome is not as good as we like to. No, it's not on the top. No, we're probably in the middle, internationally. So there's a lot we can do. Make sure we have the best outcome for the money taxpayers spend on so many things. So I want to thank Betty and every one of them. Charles B. Wang Center is one of the protocol or role model for others to follow. They spend money wisely, but they have good outcomes. And also not only medical care, they also refer you if you have other problems, like social problems, what do you call those referrals? Social workers, yeah. So it's important we have comprehensive health care, not just medicine, yeah. Not just medicine, comprehensive. You can refer them to get Medicaid, you can tell them where to apply for senior housing or food stamps. All these combined together will make good health care. So I don't want to bore you for a long speech. That's all I want to say. Thank you very much for attending. All the healthcare providers, all the insurance companies, all the banks, we work together to make Flushing one of the best communities. Thank you.
Betty, we need to add Peter to our marketing team, I think. Okay, great. So next, I would like to welcome Deputy Queensborough President Ebony Young to accept our appreciation. The Queensborough President's Office has provided over $3 million in capital funding for this project. has helped us disentangle obstacles along the way that accompany any large project like this. So, Ebony, thank you for being here, and please come to the podium.
Tata, how is everyone doing today? Yes, I am up on all of my languages living in Queens, so this is a great theme. It is a blessed day, and the borough president is very excited to have supported such a tremendous project. We need to destigmatize mental health. Therapy needs to be normalized. This building is beautiful, and I know that when we go on this tour, we'll see great bricks and mortar and photos and art, but who really matters? The people that are walking on this street every day, suffering in silence. You are their hope. And so for that, the borough president thanks you, and we honor the 40-year veterans like Janet, who have worked so very hard at making sure that hope for people stays alive. And so for that, we thank you. And for that, the borough president offers continuous blessings on this space. See you later. Have a great day.
So in addition to these partners we've heard from, this project would not be possible without generous giving through the Healthview Capital Campaign. And it's my honor to recognize some of the top donors to that capital campaign. So there's the Charles B. Wang International Foundation, Marie Lam, Ken Chin, Emily Wu, Irene Chu, Victor Lee, Livia Wan. Let's give them all. And finally, the largest gift in support of the completion of this project came in the form of a $10 million gift and a $7 million loan from the Chinatown Health Clinic Foundation. And at this time, I'd like to invite the president of the Chinatown Health Clinic Foundation, Dr. Raymond Fong, to the podium to accept our appreciation for all the work the foundation does and to offer his thoughts on how this project advances the mission of the foundation.
Can everybody hear me? Okay, so on behalf of the Health Clinic Foundation, we're thrilled to see the completion of this massive project. I think it took like 5 years. Congratulations to everyone who was involved, and in particular, I want to recognize the planning team. Steve Ellis, okay, and your group, can you raise your hands? And in particular, there is one other person, Lynn Sherman. Where is she? Come up here, Lynn. Don't hide. Capo to capo. It's a time for heads of heads, captain of captains. Lynn, okay, you did everything.
Thank you.
Okay, it's good that she has ADHD. 4 hours a night. Kidding. But really, thank you very much. So, the foundation mission is to support the work of the Charles B. Wang Center and now the Healthview Center. We want to provide quality health care, okay, and not only to underserved Asian Americans, but I want to underline in boldface this next phrase, other vulnerable populations. Thanks to the generosity of our donors, some of who've been mentioned, we donated $10 million. We gave a $7 million loan. But this new center, okay, our mission is still not complete. And why is that? It's a tumultuous and divisive political period. And I would like to remind people here of a poem by Elma Lazarus, 1883. Any historians? Okay, I'm sure you recognize it. It's on the plaque, on the Statue of Liberty. Give me your tired, your poor, your huddled masses yearning to breathe free. As long as there's a need, our mission will never be complete. Thank you.
I want to acknowledge everyone on our staff who worked on this project. Could anyone who contributed to this project in any way stand up, please?
Woo!
Everyone's working, so no one's here.
Steve.
Steve, come on up here. It was truly a labor of love, and you've all worked at it for years. This is really a crowning achievement. Congratulations.
Thank you.
And while Lynn is here, Lynn has been our fearless leader in all phases of this project so far, and she works tirelessly on this. This is a really complicated project that can go wrong in so many ways, you know, and she's led us through that, relying sometimes on finesse and sometimes on sheer force of will, as only she can. And so I'd like to present her on behalf of the whole health center and the board. You know, Lynn, one day your name will be on the walls here, but for right now, the Charles B. Wang Community Health Center presents this recognition to Lynn Sherman in sincere appreciation of her tireless dedication to expanding high-quality healthcare in our community. Okay, finally, we'd like to honor a former employee who happens to be the former CEO, Jane Eng. Jane is my predecessor, but it feels funny to say that because she has about 37 years on me when it comes to experience. Jane, you shepherded this organization to what it is today, and you're part of the Healthview project from the very beginning. You should be very proud. This is part of your legacy, and congratulations to you as well.
Good afternoon. I first came to the Chinatown Health Clinic in 1975, fresh out of law school and a judicial clerkship. During my 45 years of association with the health center, I served as executive director, board member, administrator, and president and chief executive officer. It has been a great privilege to be part of the health center's history, its growth, and now its future. We started from humble beginnings in a walk-up loft at 22 Catherine Street, providing services part-time and relying on 3 volunteer doctors to provide health care. With the help of grants from private foundations, the New York Lung Association, the TB Foundation, and the Robert Wood Johnson Foundation, we were able to secure licensing from the New York State Department of Health and a grant from the federal government to become a community health center, a federally qualified health center. We expanded to new sites on Baxter Street and Walker Street and were able to add pediatric services and dental services. Then we added OBGYN and mental health services and bought the flagship building at 268 Canal Street. In 1997, seeing that our community was rapidly expanding in Queens, we made the decision to open a new site in Flushing. We added a second site in Flushing in 2016. We conducted an ongoing search for 5 or 6 years for more space to provide services to the ever-growing, flourishing community. The opening today of this Healthview site represents a dream come true for our board members and our staff. I just wanted to take a minute to thank all of the many people who worked so hard and persevered to make this Healthview project a great success. Lynn Sherman and her whole team, including Steve Ellis, Chris Framusa, Kristen Moy, and everybody who contributed to building the new site. Betty Chang and Maggie Wang for their contributions in navigating our way through the community board and especially the Land Use Planning Committee. I want to thank everybody who worked on the financing of the new $75 million site. Lynn Sherman, again, Diyoung Chan, and Panayusiro Watana for securing the new market tax credits, the Build NYC bonds, and including the requisitions through Flushing Bank. And I see that we have several representatives from Flushing Bank here today. I also want to thank the Queens Borough President and the Deputy Borough President, the New York City Council, the New York City Economic Development Corporation for their contributions towards making the building of this site possible. I want to thank our architects, Elman, Sultan, Knox, and Wood, Randy Wood and Andrew Knox, our general contractor, Ryder Construction, and Vince Matassa, our construction consultant, for helping us navigate the construction process, and our lawyers, Gail Port from Proskauer Rose, Chris Dunn from Ropes and Gray, and Lisa Lim from Ackerman, for guiding this project through all the legal intricacies of the environmental regulations and the financing pitfalls. Finally, I would like to thank our board members who worked so hard to bring this Healthview project to fruition. Philip Chong, who chaired the Healthview committee through the whole building process, and Marie Lam, who chaired the fundraising committee these many years, and all the members of the fundraising committee, and all the members of the Chinatown Health Clinic Foundation, who made the building of Healthview possible, transforming it from a dream into reality. Thank you.
Okay, we are going to end the program with my favorite part, which is to bring it back to why we're all here in the first place, which is to take care of patients. We're going to hear directly from a longtime patient here in Flushing. And introducing our patient is his doctor, who is also our chief of internal medicine in Flushing, Dr. Kangsha Gu. I'm going to brag on Dr. Gu's behalf for a second. Under her leadership and the leadership of her colleagues and at the health center has once again been recognized as a national quality leader, with particular distinction in areas like controlling diabetes and hypertension, where we ranked in the top 1% nationally. The only thing I can say negative about our internal medicine practice is we're squished in our old space. So we're really happy to have this new beautiful building where Dr. Gu and her team and so many other teams can spread out a little bit more and continue to have more and more impact in the community. So Dr. Gu, please come to the podium, and Mr. Chen, you too as well.
The Chief of Internal Medicine at Queens. I'm very proud to be here to celebrate the grand ceremony of opening of Healthview. With the growth of Flushing area, we do saw more need for the medical care. So we are glad we will move to the new building to expand our service and better serve our community. As internal medicine, we do preventive care and also cover urgent visits. During pandemic, we treat lots of COVID-infected patients, and we provide lots of COVID vaccine to prevent the disease in the community. We have very good doctors, nurses, and also supportive team. We also have a lot of respect for patients. So right now, let me introduce Mr. Chen to give us a speak. 大家好，我是王嘉莲，法拉盛地区的内科主管。今天很高兴能和大家一起庆祝这个 Healthview 的开幕大典。随着法拉盛社区的繁荣，我们看到对医疗需求的增加，我们很高兴将能搬到这个新的building， 然后来扩展我们的业务，更好的为我们的社区服务。作为内科，我们平时承接门急诊工作。新冠期间，我们治疗了大量的新冠病人，也给社区提供了很多的新冠疫苗来预防这个疾病。我们有很好的医护团队和我们也有很多非常值得尊重的病人。接下来让我介绍我的病人陈先生给大家讲话。
大家好，我叫陈平，我是顾医生的病人。 我在晚嘉年中心医院看诊已经11年多了。医疗中心医生和所有的医护人员不仅医术精进，同时还耐心负责，像对待家人一样的对待病人。
Hello everyone, my name is Ping Chen. I'm a patient of Dr. Kang Xiaogu. I have been a patient at the Charles B. Wang Community Health Center for 11 years. All the doctors and medical staff at the health center not only have excellent medical skills, but are also very patient and responsible. They treat their patients like their own family members.
让我非常感动的一个事情，有一次我是静脉曲张，到顾医生那边看诊，小腿当时有黑了，又有痛，顾医生立即把我鞋子脱掉，袜子脱掉。当时我马上说，我自己来。但是顾医生说你年龄大了，我帮助你做，不要动，这非常感动。让我来帮了，这是医者父母心。顾医生对我们病人好像对待自己父母一样的爱心、仁爱，谢谢。
What touched me the most was that once I went to see Dr. Gu for varicose veins. My cough was already a little black back then. Dr. Gu immediately helped me take off my shoes and socks for a checkup. I said no, I could do it myself, but Dr. Gu insisted. It's okay, sit still and let me help you. Dr. Gu truly treats her patients like her own parents, with kindness and compassion.
我是2011年来美国，我从福州移民到美国，和大多数新移民一样的，不会讲英语。医疗中心很多双语员工亲自为普通话和我交流，让我很安心。让我衷心感谢医疗中心的领导、医生、所有的工作人员，你们为移民社区做出巨大的贡献。
I immigrated to the United States from Fuzhou in 2011. Like most new immigrants, I do not speak English. Many bilingual staff in the health center talk to me in Mandarin, which makes me feel at ease. Heartfelt thanks to leadership, providers, and all staff at the health center for the tremendous contribution you have made to the immigrant community.
我今天也很高兴，医疗中心开设了牙科，为了方便更多的布拉塞民众看牙，我衷心希望医疗中心可越办越好，未来能增设更多的地点和服务，继续照顾社区。
I'm thrilled that the new health center's location will open dental services to make it easier for people living in Flushing to get their teeth checked. I also sincerely hope that the health center can improve and add more locations and services in the future to continue to benefit the community.
谢谢大家。
Okay, it is time to cut the ribbon and welcome the lion dancers, and then we'll proceed into our open house. So Chris is going to walk us through the next few steps of the program. Please listen to him very carefully.
Thanks so much, Kaushal. As Kaushal stated, now we're ready for our ribbon cutting part of the ceremony. So I just ask everyone to bear with us for a few moments as we get set up for the ribbon cutting. So just please remain in your seats unless directed otherwise.
1, 2, 3, cut!